everybody, and welcome to another fruitful edition of the Shot from Obesity podcast. Today, our focus is about the very important topic of contamination control in the field of aseptic filling. My name is Neus, and today with me is Robert Linda and Sven Pulle. With them, I will talk about different aspects that you should be aware of when handling sterile primary packaging. But before we start, let me shortly introduce you the experts. Sven is Global Product Manager for prefilled syringes at Schott. He joined Schott 3 years ago and gains a lot of experience in the development of syringes and adjacent products. Secondly, we have Robert. He's Global Product Manager for ready-to-use vials at Schott Pharmaceutical Systems. He joined Schott also 3 years ago. Before his current position, Robert collected experiences with functional coatings and surface characterization. So let me welcome Sven and Robert. Hello, Sven.
Hello,
Robert.
Hello.
Hello, Neos.
So I would say let's start. Starting with a more general part. Why is contamination control such an important topic?
So maybe I will start with that. In general, we do have the overall market trends, right, that are going to the direction of aseptic filling. So if we are thinking about patient-centric treatments and all the topics arising with product lifecycle management, we have the overall trend in the industry that it's going more and more into the direction of ready-to-use containers and also more biologics that are being filled and administered in the end, of course. And the huge problem when handling biologics is that most of them, they are not compatible with the terminal sterilization, especially heat sterilization. So the proteins and antibodies, they would denature and not have any therapeutic benefit in the end. And therefore, we have to do the aseptic filling, which means that already in the filling step, everything is sterile, and that means, of course, that everything that goes into the filling chamber, so the aseptic isolator, must be sterile. And I think this is very crucial to aseptic filling.
Yeah, and contamination is also among the main reasons for recalls, according to the FDA. If you ask FDA inspectors about incorrect actions they commonly observe, there are many in the category of contamination. So failures to disinfect materials before introducing them into ISO 5 aseptic processing area.
Okay, so I understand how critical contamination is. So how is this topic, how is the contamination currently being controlled?
So currently, there are a lot of controls installed. Yeah, so we do have clean room procedures. So staff that is moving around the clean room, they have to wear proper gowning. They should not move too fast in order to avoid the stir up of particles and dust from the surfaces that may be present. And of course, there are also proper cleaning schedules, right? Then additionally, we have technical measures such as unidirectional airflows. And let's say for the filling part in general, right? We see a movement away from these RAB systems, so these restricted access barrier systems, to really completely isolated compartments. And this is all to minimize the human intervention, because the human factor is let's say one of the biggest drivers for contamination. And that's also why we need to do a surface decontamination before locking in the components, right? Because you need to make sure that everything, as I said before, everything that goes into the aseptic isolator needs to be sterile. And surface decontamination is also highly critical, of course, for the ready-to-use containers that are being used and for filling the pharmaceuticals.
Okay. So, relation to that, I would have two questions here, maybe to one of you, to Sven or Robert. So, why do I need to decontaminate the surfaces of the ready-to-use container? And the second is, how is that being implemented technically as of today?
Yeah, there's no real end-to-end assurance of sterility with current packaging. So the sterile barrier for RTU containers is on tub and Tyvek level. That means that the containers inside the tub are sterile, but the outer side of the tub needs surface decontamination. Technologies used for this purpose are E-beam as a kind of a gold standard, VHP, that is vaporized hydrogen peroxide, UV light, or manual decontamination with alcohol wipe.
Okay, thank you for mentioning these technical solutions. Could you mention briefly the pros and cons of this let's say decontamination technologies?
Yeah, sure. So the E-beam as a gold standard is easy to validate, but expensive, and it needs radiation safety management. VHP is a batch process and can leave residuals harmful to biologics. UV light is prone to shadowing as it does not penetrate the matter. And for alcohol wipes, as I mentioned before, it's cheap, but it's hard to validate and prone to error because it's a manual process. However, these are corrective actions as the contamination cannot be ruled out.
Okay. If these technologies are corrective only, as you just mentioned, can we do also something preventive?
Yeah, of course. Of course, you can do something preventive. I mean, you need to avoid contamination in the first place. And for this, for several years already, a larger group of stakeholders in the industry has developed the concept of no-touch transfer in order to really address this contamination prevention. And what it does is that it provides this end-to-end assurance of sterility. So right from the point where the ready-to-use containers are being sterilized, right after they have been washed and nested and tubbed and packed, um, the sterility is assured all the way into the aseptic isolator with this end-to-end concept, so that we can really assure that no contamination is ending up in the containers in the end.
The concept is built on two pillars. The first pillar is assurance of sterility on the tub outside, which is critical as the tub enters the aseptic isolator. And this is built into the secondary packaging. The second pillar is the protection of the sterility during the stepwise lock-in into the aseptic isolator. So the two debagging and transfer steps. This is covered by the machining concept. And these two parts combined allow for the aforementioned end-to-end assurance of sterility.
So, and maybe I can briefly add that the machining concept, which is let's say one part of it, is already available, so that you have semi-manual or semi-automatic and fully automatic debagging with the respective sterility protection measures in place. So that is already available. And the secondary packaging part, which is of course the speciality of SCHOTT, in this case, this has been also currently been launched with our SCHOTT IQ Integri bag, and this perfectly bridges this gap we have between the sterilizator and the isolator. And these two pillars together then really allow us to assure this end-to-end sterility, which is highly crucial, of course, for aseptic filling.
Okay, this sounds very interesting. What are exactly the key features of the Shot IQ Integra bag?
Our Shot IQ Integra bag combines industry-leading materials with outstanding production processes for the next level of product safety. So we have a layer by layer concept, and the different layers act as guards, interconnecting into an outstandingly safe security system. As a safeguard number one, we have a Tyvek pouch, and which is a proven material for pharmaceutical packaging. And as a safeguard two, we have a laminate foil design for enhanced durability. This is combined into one bag, and on top of that, we have safeguard number three, which is provides a seam seal for 100% visual inspection. All these smart security features add up to ensured sterility inside the second bag, also inside the inner bag. It's a two-bag solution, so that no additional decontamination steps of the outside of the tub are needed. So this is making, these features make Shot IQ Integra bag a sophisticated solution for all RTU container types, so for syringes, vials, and cartridges. The bag enables no-touch transfer operations and provides an unmatched safety for the products. Yeah.
What does it mean for interested companies? Could they already have access and order this Shot IQ Integra bag? How would be the process to get access to this new and try this new product?
So yeah, of course, pharma companies can reach out to us, and we can definitely talk about the details and how we can implement that in order to mitigate the risks of their fill and finish processes, right? Because nobody wants to have product recalls in the end, and nobody wants to be accountable for for human damage, right, in the end. And that's why we should make the processes safer. And Shot is very happy to play a part of that.
Great. So with that, I would say we're done with our conversation today. So thanks a lot to you both, Sven and Robert, for taking the time and sharing with us your knowledge. I wish you good success with the recent launch of the Shot IQ Integra bag, and I look forward to hearing from you and the development in the future sessions. I also would like to thank the audience out there for taking the time, and I hope it was an informative session. Feel free to watch the webinar related to this session where Sven and Robert showed in pictures the Shot IQ Integra bag. So I think this helps a lot to understand the whole solution. You can find this webinar and other webinars held in the past at world.shot.com. Thank you and bye-bye.